Hello, and welcome back to Under the Orange Lights, a live webcast that connects the Orangetheory community with industry experts. I'm your host, Dr. Rachel Reed. I'm an exercise physiologist and the Senior Director of Health Science and Research here at Orangetheory Fitness. Today, I'm so excited to be talking with Dr. Sanchez from the American Heart Association. He's a medical doctor. He also holds a master's in public health. He's held countless leadership roles in the medical and health fields, and he's currently AHA's Chief Medical Officer for Prevention. And today our conversations will cover more about what the American Heart Association does. We'll talk all about heart disease, what it is, whom it impacts. We'll also cover Life Simple 7 and so much more. We're so glad to have you here, Dr. Sanchez. Thank you so much for being here today.
I'm glad to be with you, Dr. Reed. Let's go to first names.
Okay, we can do that. Well, Eduardo, thank you so much for being here. I figured we could start by talking a little bit about what the American Heart Association does. I know most people tuning in have heard of AHA before, but they may not be familiar with all the amazing work and research that AHA does.
Well, I'll just touch upon a little bit. The American Heart Association has been around for almost 100 years. We are an organization that has dedicated itself to addressing those things that cause cardiovascular disease and stroke and cardiovascular disease and stroke prevention. And as we have done that, we've not only focused on medical care, but we've also focused on lifestyles. We've focused on something called social determinants of health. We could talk about that later. How much money you have or how much education you have sometimes influences what you're able to do to stay healthy. The American Heart Association's mission statement, got to get it in, is to be a relentless force for longer, healthier lives. And I say that because it is a really broad mission statement. The word medicine, healthcare, not in there. It is about a commitment to do whatever it takes to be able to make people's lives better and longer.
Well, I love the mission statement, and it's actually so similar to Orangetheory's mission statement to help our members live longer, more vibrant lives, which is one of the reasons we wanted to collaborate and partner with you guys at AHA, because I feel like we have two brands that have so much synergy. So we're excited to talk to you today about Heart Health Month. Tell us about Heart Health Month.
Well, Heart Health Month is the month of February, where we focus every day, the whole month, on bringing information to people, information they can use that is going to help them be heart healthy. I think this Friday is Wear Red Day, but what I would say is not just wear red and do something that you don't ordinarily do to be healthy. It could include going to Orangetheory for a workout.
Well, we would certainly love that, because a lot of our studios will be celebrating National Wear Red Day this Friday as well. And this is a really good time to remind our audience that they can type into the chat. We'd love for you to let us know where you're here from. Maybe type in your hometown, your home studio, maybe even send a little heart in the chat. And don't forget, you can put questions in there that we'll be able to address live with Dr. Sanchez here today. So, heart disease. Tell us a little bit about what it is, the epidemiology of it. Where does it come from? How many people does it affect? Why does it have its own month dedicated to awareness?
Let's start with what's heart disease. Heart disease is exactly that. It's diseases that affect the heart. There's a broad constellation of conditions, everything from little babies that are born with congenital heart disease to older persons who develop heart failure and kind of all things in between. But when we talk about heart disease at the American Heart Association, the main thing that we're talking about is something called atherosclerotic heart disease. And that's way too many syllables, but that's when we talk about heart vessels that get clogged with cholesterol and cause heart attacks when it's the heart. And when it's the arteries that go to your brain, it can cause strokes. And so heart disease and stroke are the things we focus on, but heart disease is much broader. Why do we focus on it? the number one cause of death in the United States up until COVID was heart disease. And the number 5 cause of death in the United States is stroke. But I think the important thing is that much like we're thinking about vaccines for COVID-19 and how to go get one, there are a number of things that we can do every single day to reduce the likelihood that you as an individual or we as a group of people in the United States are going to have heart disease and stroke continue to be the number 1 and number 5 causes of death. So many of those deaths are preventable, and too many of those deaths occur way before a person ought to have been looking right in the face of and dealing with death and their families. So heart disease includes all of those things. We focus on heart disease includes that constellation. Atherosclerotic disease is what we talk about. And what we at the Heart Association focus on are the risk factors for heart disease. Some of them are modifiable. You can change those risk factors and increase the likelihood that you're going to live a long, healthy life. Some of them you can't change. One risk factor is your age. Much more likely to have heart disease if you're 60 than if you're 20, but you can't do a whole lot about the aging process, but you can do something about the other modifiable risk factors.
And I think that's such an important message. You mentioned social determinants of health earlier, right? And this is exactly what that's talking about. There are some things about us that we really have very little control over. And unfortunately, some of those things do impact our ability to make healthy choices all of the time. Let's talk about that a little bit, because I know that's something that's at the forefront of people's minds of conversations with COVID.
Absolutely. So I talked about modifiable risk factors, and Rachel, you mentioned earlier Life Simple 7, I think. You will see that I've got a 7 on my, it would be a lapel if I was wearing a jacket, but I'm wearing AHA bling. And just so you see, it's got the AHA logo on it. And this is Heartwalk wear. Life Simple 7 are the 7 modifiable risk factors for heart disease and stroke, but they are also the way the American Heart Association defines the ability to achieve optimal heart health. The 7: not smoking, being physically active, eating healthfully, maintaining a healthy weight, having a healthy blood pressure, healthy cholesterol, healthy blood glucose. If you are good on those 7 things when you reach 50 years old, the likelihood of living a long, healthy life into your 80s is much higher than if you're not. While I said at 50, 2 things: it's never too late to start, but if you think that because you're turning 50 in 2 weeks, you're going to turn your life around in those 2 weeks, get started because you will benefit, but you need a little bit of lag and lead time.
Well, we actually have a question from the audience that I think fits really well with what you're talking about. She says, at 73 years old, can my heart still get stronger and stronger if I adhere to Life Simple 7?
So I would say your heart could probably get stronger and stronger, but more importantly, if your heart is already strong, you can maintain it at that really strong level. So there's the reaching a level and staying there, and there's the making it stronger. And I would just be called a malpractice doctor if I didn't encourage you, a 73-year-old person, to do all the things you can do to stay good or get even better on any or all of Life Simple 7.
I love that. Well, there you have it, Jane, who wrote in with that question. Okay, so let's talk a little bit more about Life Simple 7, because you went through them quickly, but I want to highlight them again for our audience who's tuning in. So the first one was stop smoking, right? Yep. We know there's a lot of research to suggest that smoking is not good for us in so many ways. Can you talk about that just a little bit more?
Absolutely. So let me just tell you what smoking does. Smoking is still probably the leading, or at worst, the number 2 cause of preventable death in the United States of America. And while I figure that most of us who are engaged in this right now do not smoke, all of us know somebody who does, and we should do what we can to, in a comfortable way, suggest not. But the thing is that if you quit smoking today, almost immediately the likelihood of something like a heart attack or a stroke or an asthma attack goes down. And over the course of time, you start achieving the benefits of never having been a smoker. You get closer and closer to not being a smoker. What does smoking do? Smoking accelerates the atherosclerotic process. That is the process of cholesterol collecting on blood vessels and putting you at much higher risk of heart disease and stroke. The other thing about tobacco, and smoke in particular, is that secondhand smoke can cause hurt to other people. So smoking is not only bad for you, it can be bad for people who are around you. So stop smoking, and it's easier to say than it is to do, but a doctor can prescribe smoking cessation therapy that can help you maintain in a non-nicotine state over the course of a little bit of time.
That's super helpful. And so this is a good reminder for everybody too, that you should be going to your annual well visits with your doctor, right? To talk about things like this, all of these modifiable risk factors that you can take control over.
That is such a great point, Rachel. And I will say that annual visit with your doctor is to make sure you're good on Simple 7, good on a few other things, cancer screening and some other stuff, flu vaccine. If you haven't gotten one, go get it. And COVID-19 vaccine, when it's your turn, get in line and go get the vaccine. The science is really strong and the protection is really good. So what is really motivating me now, so I have a grandmother. I have a mother, 86 years old. She lives in Pembroke Pines. She got her second shot. I am really, really super excited. My mother-in-law who lives in Dallas has gotten her second shot. The thing is, people who get their COVID-19 shots are not dying of COVID-19, much less likely to end up in the hospital. But let's get back to heart disease and stroke. COVID-19, if you have an underlying heart condition, COVID-19 vaccine protects you from not only COVID-19, but the possibility of a heart attack or stroke while you are infected with COVID-19.
That's an important message, because I've actually seen several comments from the audience wanting to know more about COVID as it's related to heart disease. So you covered it before I even asked you. Okay,
well, so there's more. I'll tell you more. So one is that COVID itself can cause damage to the heart muscle. And then one might have long-lasting heart failure as a result. But the other thing we know is that if you have high blood pressure, other of the cardiovascular diseases in that constellation of heart disease puts you at higher risk of having severe or even fatal, that is COVID, that will kill you. So if you are in that category, protect yourself. Now's my chance, Rachel, to show off my mask. Wear a mask when you're out in public and out and about. And again, when the opportunity presents itself, get in line, put out your arm, get vaccinated.
Yep, I cannot wait to get the email that it's my turn to get the vaccine. So I'll be rushing that morning to get it. Okay, so love the conversation. So many good comments coming in too. Don't forget, audience, that you can write any questions, comments into the chat so that we can address them in live time. The second key factor here in Life Simple 7 is to eat better. And gosh, that's like an all-encompassing catch-all way to say that you should really be paying attention to what you're putting into your body, right? And that's easy to say, hard to do, much like the one we were just talking about. Tell us a little more about eating better.
I think there's some keys. One, we probably can all eat a few more fruits and vegetables than we do. If you're eating animal-based protein, eat lean protein. Plant-based protein is terrific. And if you don't eat much of it, more won't hurt. And if you don't eat any of it, learn to enjoy it. It's good stuff. There's all kinds of plant-based proteins. Nuts, seeds, legumes, which are beans, are a terrific thing to include in your diet. Some things to limit. The amount of sugar you eat every day should be something you are mindful of and think about. The amount of fat, particularly the kinds of fat that is
Oops, Dr. Sanchez, I think we lost
you. Include it completely, that's great. And limit salt, because for some of us, salt can be potentiate, can make high blood pressure happen. So limit a few things and eat more fruits, vegetables, and let me not forget whole grains in your diet. also a good thing.
I love that. And we've talked before on past episodes of Under the Orange Lights on how to make really small changes that add up over time. And I know with nutrition, that's a strategy that often helps a lot of people. And the same can be said for our third of Life Simple 7, which is becoming more physically active, right? This is something that even, I feel like I need to move as we're talking about it. Even just increasing your physical activity by a little bit can make a really big difference when it comes to heart health and so many other types of health too, right?
That's exactly right. So long ago, when I had the opportunity to run a health department in the state of Texas, move more was one of the things I said a lot, and move more continues to be the advice that we give. Whatever you do, a little bit more is probably good. For those who are people who don't move at all, and you happen to be on this video cast, if you walk 5 minutes a day and you never have, first of all, that's good for you. And I promise you, when you get to 5 minutes a day, you'll be able to go to 10 minutes a day and to 15 minutes a day. And there comes a point where that walk gives you such a buzz back that it improves not only your physical health, it improves your well-being. And I've been saying to people in this time of COVID, get outside to do some of that movement. Just because sun has this amazing therapeutic effect on us. And even if it's just sitting in your yard or standing in your yard, get out there and get some sun.
I love that. And actually, we have some really amazing stories happening here in our chat. One comment from Neil. Neil says that they will be 63 years young in just 12 days. Currently, 259 straight days of 11,000 or more steps. That is awesome.
That's terrific. I see that Orangetheory is my daily dose of mental and physical therapy. There is no doubt that physical activity is good for your brain as well as your body. And there's really good evidence that maintaining a high level of physical activity, an optimal level of physical activity, and you're going to ask me about that in a moment, Rachel. That optimal level, or the recommended level of physical activity, again, is not only good for your physical health and for your heart, but it turns out that it reduces the likelihood that you will have a depression episode if you are somebody who's prone to them. And if you do have a depression episode, it helps attenuate, bring down the severity. And actually, physical activity as part of Life Simple 7 helps reduce the risk of the development of Alzheimer's. So it is, if there's a silver bullet out there, physical activity and the other 6 of the Simple 7 are the components of that magical pill.
Woo, I love that. So, okay, optimal dose of physical activity. What is the optimal dose according to the AHA and decades and decades of research to support this?
Yeah, so what we recommend is 30 minutes of moderate to vigorous physical activity every day. And moderate physical activity is kind of easy peasy for anyone who's doing Orangetheory. Moderate physical activity is walking at a 3 to 4 mile an hour pace. That means walking a mile in 20 minutes or walking a mile in 15 minutes, which 15 is huffing it. 20 is doable. And if you can get the couch potatoes in your family to go out for a walk and walk that fast, you are imparting on them some heart health. And then vigorous physical activity is anything above a running pace of 10 minutes, 10-minute miles, so 6 miles an hour. And anything that is at that level of exertion and above is vigorous physical activity. So if you're doing Orangetheory, I know you're hitting those that 30-minute advice, that 30-minute level 5 days a week, at least 5 days a week. And if you're doing vigorous physical activity, the 30 minutes 5 days a week goes down to 75 minutes. So you can, if you're more intense, you can do less, but it doesn't hurt to be intense 5 days or 6 days or 7 days a week.
Yeah, speaking of that higher intensity or vigorous exercise, what does the research show us about vigorous intensity exercise and heart health? Like, is that also really, really beneficial?
So the science, beneficial, yes, it appears to be. So what the science shows us is that better cardiorespiratory fitness equals longer, healthier life. And you achieve and attain higher cardiorespiratory fitness by level of intensity in your physical activity. So that science is pretty well borne out. So longer, healthier life, be vigorously physically active on a regular basis.
I love that. And I also love the message that you threaded in there of just starting, like helping other people that you know to be just a little bit more physically active, because that can be so empowering, and you are imparting on them better heart health, as you mentioned. Okay, one more thing about physical activity before we move on in the Simple 7. We had talked briefly before about a study about housekeepers that worked in the hotel industry. Can you tell us about that study?
Yeah, so this was this study where they had housekeepers in hotels. They broke them into two groups. One group was told, you know what, when you are doing your cleaning in the rooms, you are doing physical activity that benefits your health, your heart health. And the other group wasn't told that. 6 weeks or 12 weeks later, what they found is that the group that had been told that there was this value to what they did from a health perspective actually had lost a little bit of weight and were more fit than the other group. And what I was saying to Rachel is, what I imagine this, that person who was cleaning the, sweeping or doing the vacuuming was doing it with a little bit more vigor than she might have otherwise, and cleaning the bathroom with a little bit more motion, and all of that adds to your physical activity. And if you think about it, it was one of those, without knowing it, high intensity interval therapy, where vacuuming, changing the bed, cleaning the bathroom. I don't know about the toilet, but all of those were conferring some additional value. So when you hear these messages of the positive effect, in many of us, it has the effect of encouraging us, emboldening us to go on and do more. So those messages to our family members, and we all have family members who look at us and say things, and rather than get into an exchange, go for a walk, go for a hike, do it outside, and add to what you did at OTF.
I love that. I think that's such great advice. Okay, so the fourth one is maintaining a healthy weight. Talk to us briefly about that.
So I like to focus these days on, rather than how much you weigh, is focus on the other two earlier lifestyle changes. If you eat healthfully and you are physically active, you will likely gravitate to a healthier weight wherever you are. And if you feel like you've got to do a little bit more, the key is the part of the key. It's not simple. Eating healthier, and eating less. However much you eat, eating less doesn't mean you need to starve yourself. And moving more is going to help you get there. But rather than focus on weight, because sometimes we do that to the detriment of even our own self-esteem, focus on the healthy eating, the physical activity, and then on the other three, make sure that you've checked your numbers, and you know what your blood pressure is, and somebody checked your lipids, and somebody checked your glucose level, and you can get right around those things. The good news is that whether it's weight, blood pressure, cholesterol, or even glucose, healthy eating and physical activity can help get you to a better place with regards to those. You might need to be on medications, but they might not need to be as strong or as many or any medications at all if you can achieve those changes. And again, we're all different. There's no magic bullet for those particular things. But one thing I would tell you, being more physically active and eating healthy, there is no downside to that. None whatsoever. And I promise you, as I've talked about Life Simple 7, it will add to the likelihood of a longer, healthier life.
I love that. And we actually have a question from the audience here. It says, shouldn't we be paying more attention to body fat, so body composition, rather than just the number on the scale? What are your thoughts there?
Yes, that is absolutely correct. So sometimes we focus on body mass index, and whether and someone like Emmett Smith is a person who comes to mind. Think of your favorite running back who plays football. That person probably has a high BMI, but I think Rachel and I would agree. BMI is a screen. It is not an absolute. So if it's high, you see somebody in a clinical setting and you think to yourself, whoa, that's a lot of muscle. And so my advice for that person is going to not be about the same thing that I would give in terms of advice and or warnings to somebody who has a lot of extra adipose tissue, which is the fancy terminology for fat.
Right. No, I completely agree. Really good question from the audience there. And a shout out to Pamela, who just finished an outside 1 mile per day challenge for a month. She used it for a cool down after OTF, which is
that's
amazing.
awesome.
I know. I love seeing how physically active the audience is. So that's fantastic. Okay. Any more information you can share quickly on managing blood pressure? Because I know hypertension is something that has pretty high rates in America and really globally too.
Yeah, I think what's really important is get your blood pressure taken. The American Heart Association now recommends that the level of control is below 130/80. It used to be a slightly higher number. 130/80 is what you want to be below. Go see your doctor. If it's high, go see your doctor. And what a doctor should be doing, advice, is to confirm that your blood pressure is high by having you measure it at home for several days in a row in the morning and at night and figure out what exactly is going on. If it's high, along with lifestyle, eating healthier, which includes a Mediterranean-like diet, which actually we talked about without using those words, and includes low salt, but also includes physical activity, moderate, if any, alcohol consumption. Those are key elements, along with taking your medication if it's prescribed. And if you have not been physically active or are not eating healthfully, doing the things that I talked about may result in not only blood pressure being controlled, but also in you being able to be off of the medication that was prescribed. Blood pressure is a serious thing, though. Do not blow it off. It causes damage in your heart, as we described it, as I was describing about tobacco. High blood pressure accelerates atherosclerotic disease, so increases the likelihood of heart attack, stroke, heart failure. But it also does damage to your kidneys. It does damage in other parts of your body. It is to be taken very seriously. But the thing is that it's really easy to treat. The medications don't have a lot of side effects. And if you need to be on it, that's a good thing to get addressed. Blood pressure, a serious thing.
I totally agree. And actually on our Instagram stories earlier this week, one of our followers wrote in with this question. She says, I'm relatively healthy, but hypertension runs in her family. What health behaviors should she include in her lifestyle to help control her blood pressure or limit her risk for hypertension?
So again, healthy eating, which includes low salt. It actually also, the recommendations now, glad you asked, include more potassium in your diet. So more potassium, less salt. You should search DASH diet. That's dietary approach to stop hypertension. It's an AHA science-based diet. So experiments were done, and that is searchable. When you look at it, it is a Mediterranean-style diet. Physical activity, critically important. We've talked about that. And again, if you are somebody who consumes a lot of alcohol, bring it down or eliminate it, because that does indeed contribute to high blood pressure. And if it's in your family, at least once a year, make sure your blood pressure is being taken, and you can know whether you are inching up or if you are under control.
Yep, I think that message of working with your medical doctor to kind of keep track of all of these numbers, including cholesterol, your blood glucose, that's so, so important. Any last words on cholesterol and blood glucose before we wrap up this part of the conversation?
Absolutely. So as it relates to cholesterol in this day and age, what doctors are doing are checking your blood cholesterol, but also doing what's called an atherosclerotic cardiovascular disease risk estimation. So it's a fancy, handy dandy formula. You plug in some information about what your sex is, what your race is, a number of the lifestyle factors, including whether you smoke or not, and it calculates out a risk. And if your risk of heart disease is above 10% or higher, you and your doctor should talk about what things you might need to do to address that higher risk. It doesn't mean that tomorrow something bad is going to happen. It means that over the course of 10 years, there's a higher risk of something bad happening, but you can do something about it now. And as it relates to glucose, every so often, your blood glucose or something called hemoglobin A1C should be checked to see that you don't have type 2 diabetes or what's called prediabetes. Prediabetes leads to diabetes. How do you prevent prediabetes from becoming diabetes? Guess what? Eat healthfully, be physically active, and a moderate amount of weight loss in experimental studies have been shown to dramatically reduce the likelihood that you will get to diabetes from prediabetes. And I think the message that I want to leave everybody, the key to all of this is to not be a smoker, to have regular physical activity a part of your life, and to eat a healthy diet every single day. Those three things are the key to everything else that we've talked about. And you can mitigate the effects of those by getting those three in as good a place as you can.
I love that. I was actually going to say, I was reading a study by Ford et al. From 2012, which talked about Life Simple 7. And the research showed that if you could kind of get a handle on at least 5 of them, it had a 78% reduced risk for heart-related death compared to people with no ideal metric. So it's not like you have to do all 7 of them and be super focused, right? You can start with one and kind of have a cascading effect there. Talk about that a little bit.
Absolutely. So if you know you don't have high blood pressure, high cholesterol, diabetes, or are overweight or obese, absolutely focus on the first 3 and start there. I would say to you, if anyone who's on this is a smoker, make that your resolution for the decade, because if you quit smoking, you will improve your life so dramatically. It is the single most important thing you can do if you're a smoker. And then I would say the combination of physical activity and healthy eating is the next thing, really, really important. And if you're not a smoker, get with the program on physical activity and healthy eating. And again, those will not only prevent the others to a large degree, but if you've got any of the others, it will help you manage those better and help protect you in spite of those, even as you take medications to control blood pressure, cholesterol, glucose.
I love that. I think we've had so many really strong takeaways for the audience tuning in. Dr. Sanchez, thank you so much. And to the audience, thank you all so much for being here live. Don't forget that this Friday is National Wear Red Day. So please join us in celebrating the cause of Heart Health Month. And yes, we have the little red sneakers.
Red sneakers, that'll work.
I love it. And check out your local studio schedules to sign up for a special 90-minute workout. It's got some high-intensity work in there, which we just talked about is really good for your heart, designed to raise funds for everything that American Heart Association does. Thank you guys all for being part of Under the Orange Lights, which is a live webcast dedicated to connecting the OTF community with industry experts just like Dr. Sanchez, who are ready to answer all of your questions. Make sure you're subscribing to our YouTube channel so you don't miss us next time we go live. And until next time, stay healthy, everybody.